As Nigeria joined the rest of the world to mark 2023 Antimicrobial Resistance Week, the Nigeria Center for Disease Control has called for increased awareness of the prevention of antimicrobial disease, which impacts negatively on citizens' health. The NCDC says that antimicrobial disease also affects the economy by stalling development.
It's a great pleasure to address you today on the occasion, or as we flag off the World 2023 World Antimicrobial Resistance Awareness Week. The theme of this week is preventing antimicrobial resistance together. Nigeria joined the global community to respond to growing threats of AMR following the World Health Assembly's adoption of the Global Action Plan on Antimicrobial Resistance in May 2015, which is now 8 years ago. In 2016, the National AMR Coordinating Body was established here at the Nigeria Center for Disease Control and Prevention. This body is called the National AMR Coordinating Committee. In addition, there is a National AMR TWG that is made up of all stakeholders or has representation of all stakeholders from the human, animal, and environmental health sectors.
As a leading public health institution, the NCDC has played a crucial role in not just raising awareness about the growing threat of antimicrobial resistance and promoting responsible antimicrobial use among healthcare professionals and the public, but also in ensuring that the policies, guidelines, and strategies that align with our local context are in place to help reduce the burden of AMR in Nigeria. As a public health nonprofit walking the talk on AMR, the safe and responsible use of antimicrobial drugs remain a critical part of our work at DRASA. Our unwavering commitment has been evident over the years through our all-inclusive, bottom-up, top-down approach to AMR. Our school-based program on AMR, community outreach programs on AMR, contagious conversations on infection prevention, including our half-hour radio show, and X-based conversations, training of healthcare workers to reduce the burden of healthcare-associated infections, engaging stakeholders across the One Health sectors, and even more recently, in our pivotal role, working with all of you here today to develop Nigeria's new National Action Plan on AMR.
We are happy to be here to continue to have this conversation on the containment and prevention of antimicrobial resistance. Antimicrobial resistance is a silent pandemic, so to speak, that is ongoing, has little or no media coverage, and little or no attention, but is a big problem that is everywhere.
We need to take urgent action and address the main causes of AMR, which include the misuse and abuse of antimicrobial medicines, lack of access to clean water, sanitation and hygiene, poor infection prevention and control practices, inadequate use of vaccine to decrease infections, inadequate lab capacity including equipment and reagents to guide proper treatment, poor waste disposal practice, and the presence of antimicrobials in food, animal production and crop protection.